Data quality is meaningless if the information going into a system comes out of it meaning something different when it arrives at the other end, when we transfer information. Information standards are really critical in health, and actually I believe they're really critical for every one of us here today. Are we using the same terminology? Are we getting to the same place? Well, those challenges that health have faced and still face every one of us. How to get that balance right between the human and the technical. Dealing with the training and the guidance through to technical controls such as smart cards and encryption. One of the challenges for health from where I sit is how they deal with accident and emergency units. Very nice to have smart card controls that ensure that the right person with the right role type accesses the right patient record, but if you've got 3 computer terminals in a very busy A&E and 10 staff running around, you can't be logging in and logging out. They need to think differently. So some of the technical controls that are there and work well for the rest of the organisation don't, from where I sit, seem to work very well there. That may be unique to health, but I suspect not. I suspect there are other areas where that needs to be done. And we can then start to say, let's look outside. Every time I go into a pub or a restaurant, I notice that the staff with a simple key go back to their login and their screen without ever logging in and out. 7 members of staff using the same terminal in less than 2 minutes. Why can't we do that in the NHS? I don't know. Maybe it's a major technical challenge. One of the other things that is constantly going on, and the issues I hear discussed, is the balance between getting clinical risks and information risks right in the health service. And I think that's something we can also consider. Sometimes we dominate on the information risk and actually then cause a problem for some other part of our service. When to share or when to not share information. In social care, my background, and in child protection in particular, it's if in doubt, share. And there is a tendency to feel that the NHS is still struggling to get out of a position of if in doubt, don't share. But as you start to work on clinical risks and information risks, bringing them together, getting some sort of balance, then that's a real challenge that we need to continue with. Big challenge, it's not just because of the new government, it would have been here regardless of the complexion of the government, is funding. Funding is always going to be challenging for the next year, next 2, next 3 years. We can't solve the problems by spending more money. We have got to spend the problems by thinking smarter and trying to learn real lessons from each other. That's why I agreed to speak today. It's how can we draw out those lessons? Not just of the things that work well, because I think people are quite good at publicising what works well, but I find I learn most when people share their failures. And perhaps today isn't the right place to stand up and do it, but actually that is where we learn most. Somebody can tell me how they've done something successfully, but if they don't share with me the bear traps that they fell into on the way, I'll probably fall into the same bear traps as well. And that is part of a smarter way of working, part of a way of using funding differently in the sense of how we share the knowledge we have, pushing that open information society between ourselves and across our organisational boundaries. I'm going to cut out talking about total place. It's just another complication for health and for all of us about how we work together to actually save money and work smarter in local places. It does seem to have broad support across the political spectrum, so I expect over the coming months people who haven't yet engaged with the concept of total place will need to, and it will certainly have implications for information governance. A real challenge, alluded to by earlier speakers, was around authentication, about identity management. And that's a real challenge in terms of citizen authentication and the NHS in trying to ensure that it can give citizens access to their own health records. How to do that without it being massively overburdensome and yet at the same time protecting some of the information we, as patients, as clients of that service, want to most protect. This is probably the point where I could sort of fall foul of politics, but actually it looks like that authentication is a challenge for several government departments at this same level. It might not matter too much who gets a driving licence, if it really is the right person. But if somebody uses their driving licence to access somebody else's benefits, somebody else's health record, it really does make a difference. And so this is probably a challenge I'm putting out to all of us, is how can we work better to improve citizen authentication when we want to give them access to their information. And then, information quality. It doesn't really matter whether it's personal information, statistical information, whatever it is. If the quality of the information is no good, why share it, why have it, why hold it, why use it? But for health, it actually can mean differences to life. And this also then presents challenges about common standards. I'll use one fairly trivial example. There is an e-government standard about sex and gender, which says that sex and gender can be used to mean the same thing in all our information systems. And for most purposes, that's absolutely fine. But if you turn up where your gender and sex aren't actually in alignment because that's how you choose it to be, or that's the way you were born, or whatever, and then you turn up for surgery, it could make a massive difference. It really is an important issue that sometimes we can agree standards across government, and we actually need to think through, has it got a special meaning, a special issue somewhere else that really could be actually quite serious. Information quality is something that I think is a big challenge where I work in the local authority sector. But I think it's just as great in health. I think there are issues about how people use terminology that carries through and can potentially cause problems. The NHS actually moved very quickly on information standards and perhaps didn't move as quickly as it should at looking to influence national and international ones. I think that's something that it is now addressing and taking on the challenge, so that when it shares information outside the health arena or needs to receive it from outside, it can make sense of it. But it will only work if the rest of us are involved in those developments, listen and engage on the same basis. So, getting very near the end, what are some of the general lessons for us? Well, the first lesson is about more and more collaboration and about reinforcing organisational learning. The NHS has been able to work as one organisation. Local government, where I work, isn't. But we still need to use our collective organisations that do exist, that don't have the same statutory basis, as a means of improving learning in a more cost-effective way. But we also need to collaborate with our citizens and with the third sector and many others, because the information we hold, if it's going to be of benefit to our citizens, really needs to be common. We need to get the balance right between local and national initiatives. We need to work stronger at getting ownership of recording practice standards in our professions. And we need to be clear that when we use certain items of terminology, that when it's critical, it means the same thing to the person we're sharing it with. And given the economic climate, how can we too pull together our purchasing power so that we could respond the way the NHS did in terms of the need to encrypt its laptops and other devices with a national contract in a very short space of time that was very, very competitive. The NHS has a strong tradition of engaging with the professions through the Royal Colleges. I'm not too sure that we engage in the same way in the professions across the rest of the public sector. If we don't, we really do need to. And then finally, constantly reviewing and keeping to that challenge of how do we maintain that balance between people and technology, between pragmatism and idealism. They're the real challenges for us as we leave today, and what each of us needs to discuss and share with others. Thank you.